So let me start off by saying, hey, thanks for submitting your grant application to the Allergist Foundation. And what inspired you to apply for the community grant?
I mean, we had a question, a clinical question that I thought was interesting. I still think it's very interested and mostly unanswered. And, you know, the community grant was a great vehicle to get that question answered. It has facilitated getting the job done.
So what was the question you wanted answered?
So with the COVID, this all started brewing with the COVID-19 pandemic. Suddenly we were forced to do telehealth. And, you know, there were some people who had done some research on telehealth before, but mostly we didn't know if in adults, which is a population that I treat in clinic, that we were studying in the Corey-sponsored prepared trial, whether telehealth was gonna be a reasonable alternative to in-person visits, whether the quality of the care that patients were getting was gonna be comparable to in-person visits. But especially in these specific patient populations within Latinx and within Black individuals with moderate, severe, persistent asthma, was just is a gap in knowledge.
So what have you learned so far from your project?
So we just submitted the abstract for the annual ACAAI, the college meeting. We just turned in those now. We found that compared the people who were seen during the specific observation period, exclusively seen in person, those whose care included telehealth, a component of telehealth, after observation through a period of time, their asthma control scores and their asthma quality of life related scores were comparable. And this is after adjustment for significant baseline differences between the two groups, and forcing also into the model whether or not they had the Pardix assignment. I can tell you a little bit more about that at the beginning, and also their baseline asthma control scores.
So equivalent to in person.
Yes, yes.
Wow.
Which I think that's not necessarily an obvious answer, right?
Yeah. I mean, I would be somewhat surprised. I mean, you would think people would do better with the hands-on personal visits, but what you're saying is if telehealth is done correctly,
yes,
it works well.
Exactly. So a lot of my patients think exactly how you first thought about it, right? I think you have a whole swath out there that thinks, if I'm going to see my specialist, I'm going to see my specialist in person. I want that stethoscope, you know, listening to my lungs. I want the person-to-person interaction. Other people think, well, but if you offer telehealth, when something comes up, then it's perhaps greater access. It's one of the possibilities. Maybe some people, it makes it, it's prohibitive to drive or find a means of transportation, or taking time off from caretaking duties or their jobs. And maybe that's the alternative argument.
Do you think this will be something that'll continue on past the pandemic because of what your study's showing us?
I don't know if it's because of what our studies are showing us, and I don't know if it's guaranteed either. I don't know if it's guaranteed either, because one thing that we're seeing now is that the reimbursements for telehealth visits are not there. It varies a lot by region. It varies a lot by payer, but that's not necessarily guaranteed. And that's part of the reason we're doing this, whether or not this is something we should continue to offer specifically for a subgroup of people who might respond well to it.
So here's a study done through our community grant program, the Allergist Foundation, coming up with results that we might be able to then take to the Advocacy Council and use to really make the argument for telehealth continuing and being reimbursed at the level that it should be reimbursed. Your study is not answering the reimbursement issue. Your study is answering, is the care equivalent?
Exactly.
Do you see this long-term benefiting community allergists?
But yes, another part of, you brought it up, is what people prefer, right? So in addition to this outcomes, which is what we proposed to the college and to the Allergist Foundation to do with this grant, another thing that we did was we created a survey to understand the preferences for in-person visits versus telehealth in specifically this population. And the sample size we got for that one was a little bit bigger, than the 90-something people that we found for the outcomes data. For the preferences survey, we had more than 900 responses, which is much more powerful. And we can exactly get to that point. So we want to have the information about, is it comparably effective, and also who are the people who prefer this, right? So to your question about, is this something that the community allergist will see later on? If it's helpful, and if we can find out who are the people who want it, and it can help them, then ideally, yes. If the data support that, especially if the data support that, then yes, I hope so.